Greetings, greetings, greetings. Welcome to Chair Pilates. I'm Nina and I'm your instructor. This is the May 29th class. Thank you so much for being here. I trust that everyone is feeling well and taking all the precautions that you need to take, and that you're just so excited to get moving in the class. So let me give you a few reminders and then we'll get started. Please remember that if you don't have a strap, it's not necessary. Please use a long tie, maybe use a towel, maybe just not use anything. Perform the movements without anything else. Also, if you don't have handheld weights, please use water bottles. Maybe you have canned goods that will fit comfortably in your hands, but if not, just use your own body weight as resistance and continue with the class. We just want you to be able to participate in the class and use what you have. You'll still get all the benefits, and I know that you're going to feel better afterwards. Lastly, remember that if you're in my college class, that the college does require that I keep attendance. So please let me know either by direct email or by leaving a comment in the comment section of this YouTube video that you were here, so that I can provide the college with accurate attendance for this spring semester. So I don't think there's anything else that I need to share with you. If I think of anything else, you know I'll share it with you during the class. And the next time you see me, I'll be seated. Okay, see you then. Wonderful, wonderful, wonderful. So we're here in our chairs, and you know the first thing we always do, we come into alignment. When we're seated, that just means that your knees will be over your ankles, your toes are pointed forward, your feet are about hip width apart, your shoulders are under your ear tips, your spine is straight, and you've pressed your sitting bones into your chairs. And you just rest your hands maybe on your quadriceps, maybe at your sides, whatever feels comfortable for you. I just want you to start out in alignment. We'll maintain the alignment throughout the class, and I want you to focus on your breathing. So before we get started, let's just relax a little bit. Take some time to focus on your breathing. Just breathing in through your nostrils, focusing on your inhalation and your exhalation. Pressing your feet into the floor. Try to bring your thoughts into this moment, into this time that we have together. No to-do list right now. We're just going to take some time for some self-care. So we know with Chair Pilates, we're going to be doing some stretching. We're going to be strengthening our core. Good. All right. So let's just inhale this time by shrugging up our shoulders and bringing them up as close to your ear tips as possible. Then pull your shoulders back. Just pull them back. You'll feel your chest opening, and then pull those shoulders down. So it's an inhale up and pull the shoulders back, pull them down, and we'll continue. Pull back, pull those shoulders down. Let's do one more. Inhale up, pull the shoulders back, pull your shoulders down. Wonderful. Now we're just going to reverse the rotation direction. So we inhale up, and this time pull the shoulders forward and then pull them down towards the floor. Inhale up and forward and pull those shoulders down. Please inhale up again. Get those shoulders as close to the ears as possible. Then you pull the shoulders forward as far as possible, and then you pull them down as far as possible. One more. And forward and pull those shoulders down. Wonderful. And so now you're just going to allow the palms of your hands to face the floor, to face the earth. Press down, please, towards the earth, toward the floor. You're pulling the shoulders down. Let's release. Let's press again. Press down. Let's release. And once again, we're going to pull those shoulders down. And we're going to relax. Good. Doesn't that feel good for your shoulders? Maybe move them forward and backward a couple of times. Good. Just helping to get that synovial fluid flowing. I don't know what you've been doing either before this video, but just in case you feel a little stiff, a little tight, we're just going to loosen up a little bit. Wonderful. All right, so we've moved those shoulders. You know, we generally start from the toes up. Today I'm starting from the top down. So we're just changing things up a little bit. So I'm going to ask you this time as you inhale, just inhale and open those arms nice and wide. So you want to feel your chest open. Lift up your chest up toward the ceiling, up toward the heavens. And then you just want to round forward, round your thoracic spine, round those shoulders forward. Inhale. Good. Lift up your chest, open up the chest, and then round forward, shoulders round, thoracic spine round. Bring the fingertips together. Inhale. And let's exhale forward. Exhale forward. Bring those fingertips together. Inhale. Open up the chest, lift up, bring those arms back, forward. Let's do one more. Inhale. Arms are open wide, chest opens. It lifts up. Now we're bringing the fingertips together as we round forward. Wonderful. Now keeping those fingertips together, bring the arms up. Now the hands are overhead. Fingertips are still together. Now release those fingertips. Bring those arms back down to your sides. Good. Then bring the arms forward. Lift up both the legs, please. Toes are pointed toward the ceiling. Palms are facing. Wonderful. Let's just hold this position. You're stretching your legs and stretching your arms. Abdominal muscles are tight. Just hold it here. And now we'll bring those feet just a few inches apart. Let's rotate the wrist. Let's rotate those ankles. It's an outward rotation to start. You decide on the speed, how fast you're going to move the ankles and the wrist. And then we stop here and let's bring that rotation inward. So the toes and the fingers are coming toward the midline of the body. Let's stop here, please. Now let's flex. Flex your fingers and your toes. Let's point. Let's flex. And we point. And we flex. And we point. Flex. And point. Now we'll do 3 more. You take a break whenever you need to take a break. This is 2. And we'll do 1 more. How are you feeling? Good. Please lower your feet. Please slide the feet back up toward the body. Once you do this, you should come back into alignment, but if not, just check the position of your toes. They should be pointed forward as much as possible. And you just want to have the feet about hip width apart. And once again, always come back into alignment. Check in on your breathing, making sure that you're breathing in and out deeply. Wonderful. All right. So now what we're going to do is this is a good stretch. However, it may require that you reposition yourself in the seat of your chair. We're just going to lift that right leg. So you're going to bring that right knee up toward your chest. You decide how high. If this is how high you're going to lift today, this is fine. You decide how high you're going to lift. Keep the abdominal muscles tight, please. Keep your spine as straight as possible. And then we lower that right foot back to the floor. Let's just stretch on the left side. So again, you're bringing the knee toward the chest, but you're deciding how high you're lifting the knee. And you're working on maintaining the abdominal muscles. And you're focusing on your breathing. And you're checking your alignment. And we lower. Let's lift the right knee again. And we lower, and the left knee. And you take your time, as I've shared throughout all of these classes. You decide how many, how fast, how slow. If I'm moving a little slow for you, then of course, if you want more of a cardiovascular session, then you just move a little faster than I'm moving. If I'm moving too fast, then of course you slow down. We're going to do 1 more on the right. Just lift up. You feel those abdominal muscles, don't you? Other muscles as well, but good. Just warming up the muscles right now, just warming up. Bring that left knee up. Good. You're probably getting warm right about now, and that's what we want to do. This is what we call warm up, getting that extra blood to the muscles. So if you're feeling a little warm, that's normal. All right. Please don't tolerate any type of pain. If you feel any pain, please don't continue. All right. So we're back in alignment once again. We're just going to lift those heels off of the floor. Feel those gastrocnemius muscles and all of these muscles in the lower part of the body. Lower your heels. And you lift. And you lower. And you lift. And lower. And lift. And lower. Keep lifting, please. And lowering. And we lift. And we lower. Let's do 4 more. This is 1. And 2. And 3. 1 more. 4. Wonderful, wonderful. So we lifted the heels. So now what we're going to do is I'm going to ask you, please extend your right leg forward. So the left foot will remain where it is. Again, you may want to reposition yourself on your chair. So the left foot is flat on the floor. The right foot has its toes pointing toward the ceiling, toward the heavens. And we're just going to extend that right leg as far forward as you feel comfortable. You'll feel your quadricep muscles, hamstrings, gastrocnemius muscles. You feel the muscles, and the toes are pointed toward the ceiling. And just hold that stretch. Left foot flat on the floor. Now let's bring the right foot back, and now let's extend that left foot. And we're doing the same thing. Monitor your posture, please. Just a nice stretch. You'll feel your abdominal muscles as well. Bring that left foot back, please. Let's do the same thing on the right. Just extend forward. And back to the left. And back. 1 more on the right, please. And last time on the left. Extend that left leg forward, toes are pointed toward the ceiling. And you bring that left foot back. Good. Hopefully you're back in alignment. If not, as you can see, I just continue to reposition myself just to get into alignment. Of course, I have something underneath my feet, so it's a little different for me. All right, so you're back in alignment. So again, what we want to do is we want to do some hip opening exercises. And I'm going to give you 2 options. Remember that if this is not comfortable for you, if bringing your ankle behind your knee is not comfortable for you, then please just cross your right ankle over your left. Take the palms of both hands and just give some pressure inside the knees so that you feel the deep hip flexors are activated. For anyone who wants a little more intensity, you bring the right ankle up. You place the right ankle behind your left knee. You use the right palm and you give a little pressure if that's what you want to do. If you want a little more intensity, you just give a little pressure inside the right knee and then you lean forward. And as you lean forward, your abdominal muscles are tight and you keep your chin out of your chest. And you can feel the hamstrings, you can feel your glutes, you can feel the deep hip flexors. If leaning forward is a little more intensity than you feel comfortable with, just bring your upper body back to neutral. And you hold this. Nice hip opening exercise. Good. Let's release that. All right. So you bring that right foot to the floor. And as I've shared with you over and over, just move a little bit, especially in the hip area, to get that synovial fluid circulating better so that your joints feel better. The synovial fluid is really there to help with your joints. So making sure that you're moving the synovial fluid, it circulates better when we move. We're going to move to the left side now. So either cross your left ankle over the right or bring that left ankle up It is now behind the right knee. Good. And once you have that there, we do the same thing with either both palms if you're crossing your ankles, or the left palm is inside the left knee. Give some pressure. If that's comfortable for you, then you lean forward. If that's comfortable, abs are tight. Hold the posture. Nice stretch. Nice hip openers. So if you've been sitting for a while, and we're seated now, so this should really feel good for the hips. The hips get tight when we sit for long periods of time. So this is good. All right, let's come back and let's just release that left side. Remember to move on the left side a little bit, just moving the movement. And sometimes tapping the feet helps, as I've shared with you. Tapping the feet helps with the circulation of the blood as well. So this good movement. All right, wonderful. So now we're going to bring ourselves back into a nice position so that when we're raising our toes and our heels that we feel comfortable. So go ahead, get repositioned. You're ready? Now your hands are either going to be on the side of your chair or you're going to be here. It's up to you. All right. So when you're ready, we're going to lift on the right side. So we're lifting the heels. We're lifting the heels. We're alternating feet. Right, left. And as I said, if I'm moving a little faster than you feel comfortable, then you just slow down the movement. But right now we're lifting the right heel and then the left heel. Our arms are here, or if this is more comfortable, they're at your sides. And you're lifting. Working the lower body muscles. Keeping the core nice and tight. Lifting. So we're going to do 4 more. Remember, a right and a left is 1, 2, 3, and this is 4. Good. Please lower both heels to the floor. Please either lower the arms or just release your fingers from the sides of your chair so that your arms are at your sides. Inhale up, please. Hold it here. Just stretch. Please just stretch. Stretch the arm up toward the heavens, toward the ceiling. Just stretch. Hold the stretch. Stretch up. If you need to take a break, then please do. And then just turn those palms back down. Inhale up on the left side. Arm comes up toward the heavens, toward the ceiling. Reach up. Abs are tight. The right arm is at your side. And you're stretching up. It's a stretch. So you want to stretch your arm up toward the ceiling, up toward the heavens. Stretch up. Please lower the right arm. Forgive me, lower that left arm. And we're going to raise the right arm again as we inhale. So stretch up, stretch. And bring the arm back to the side. Left arm comes up, inhaling up. Stretching that left arm up. Good. Now we lower that left arm back to our sides. Good. Now we're going to do a little bit of rotating for the spine. So I'll ask you to inhale up. As you exhale, please bring your hands down the midline of your body. Press those palms together. Press your fingertips together. Your hands are about chest level. Pressing together. Now just rotate to the right. You'll feel the spine rotate. Rotate to your right. And then you come back to center. Please rotate to your left. So you're rotating your spine to the left. And then you come back to center. Now rotate to the right. Back to center. Please rotate to the left. Rotate that spine to the left. Back to center. We'll do 1 more to the right. So press your fingertips together. Press your palms together. And the reason you're pressing them together is because you're pressing towards the midline of the body. You come back to center. And then you rotate to the left, rotate, feel those shoulders as well. Rotate to the left, and then you come back to center. We hold it here. Please bring your thumbs together into the chest, heart center right here. Just rest them here. Press those palms together and the fingertips, please. Good. And now we're just going to release the arms, release them. And we're going to open up wide again, open those arms up wide again. And then we're going to bring the palms and the fingertips back together again. Arms come back up, overhead, fingertips are together. And then we release, and we're coming back down to our sides. Good. How does that feel? Good. So we have stretched the entire body now. And I hope you're moving a little bit as I am with your shoulders and tapping a little bit. And we're getting ready. So again, we know this is chair Pilates. So feel free to participate in the entire class seated. However, for those of you who'd like to stand, I'm going to be standing in just a few seconds. I want to encourage anyone who remains seated, please continue performing the movements, just modify them based on being seated in the chair. Stay inspired and stay motivated. So we're just going to stand up and do a few movements standing, and then I'll be getting back into the chair soon. Okay. So now we want to work the largest muscles in the body a little bit more, our glutes. And one of the best ways to do that is with squats. We're going to do some modified squats. The important thing to remember is your core, that you keep it nice and tight. Think about your form so that you are pressing back. Your weight is going into your heels. You're bringing your glutes down as close to the seat of your chair as you feel comfortable. Please only do as many as you feel comfortable doing. Only bend your knees as much as you feel comfortable. You keep hearing it over and over. Don't overdo it. Don't overdo it. Do what you can. And this is what it's going to look like. Now, if you prefer to have your arms extended forward, and then you would and you're bringing your glutes close to the seat of your chair. Maybe you want your arms this way. Please squeeze your glutes up. Squeeze those glutes up as you're coming up. Press down. Your weight is going into the heels of your feet. You're pressing back. You don't have to squat as low as I am. Only do what feels comfortable for you. Take a break whenever you need to. 4, 3, 2, and 1. Great job. So are you ready to work almost every muscle in your body? Please come behind your chairs. And your hands are lightly placed on the back of your chairs. Extend your right toes into the floor behind you. You'll feel your glutes lift. If you'd like to just stay here, this is less intensity, please do. But if you'd like something a little bit more advanced, lift up that right leg. Your right toes are pointed forward. Abdominal muscles are still tight. And you're just going to hold it here. Your left knee is slightly bent. And just hold it here. We're almost there, about 15 more seconds. We're holding for about 30 seconds. Wonderful. Bring that right foot down. Move that right side around a little bit. Before you move over to the left side, same thing. You're going to bring those left toes behind you. Your fingertips are placed lightly on the back of your chair. If you want to just stay here with the toes in the floor and hold for about 30 seconds or the amount of time that you feel that you want to hold the hold today, then just stay here. But if you want something more advanced, you lift up that left leg and your left toes are pointed toward the floor. Your abdominal muscles are tight, and you hold it here. And you decide if 30 seconds is too much, however long. And we lower that left foot back to the floor. Move the left side around a little bit. Wonderful. We're getting stronger. And we're getting stronger. Good. I like to tap my feet a little bit. As I said, it helps with the circulation. And we're getting stronger. That's what's important. Let's keep moving. Let's keep moving. Let's keep moving. Let's keep moving. You'll feel your abdominals, your lower abdominals working as you're lifting. Right and left. Remember your own pace. Your own pace. 4 more. Right and the left is 1, 2, 3, and 4. So let's keep moving. We're going to keep working on those lower abdominal muscles, bringing that knee in towards the chin and back. Feel those lower abdominal muscles really working and getting stronger, as well as your glutes. Your pace. And that's good for the right side. Move around a little bit. You ready? Left side. Okay, let's go. Left side. Extend those toes into the floor behind you. Your pace. Two more. Wonderful. Lower abdominal work. Wonderful. So let's do some rotations for the lower back. You'll just lean forward and then you'll bring the torso around in a circular motion. And you're bringing the chest close to the body. When you get to the front, you hold it here. Let's reverse that rotation. Allow the shoulders to guide you. And this is good for the lower back. And we're back to the center. And then you just bring the upper torso back into alignment. And that should help a little bit with that lower back. So if you're standing now, let's get behind our chairs and place our hands lightly on the back of the chairs. Our feet now are about shoulder width apart. Toes are pointed forward to the degree possible. And what we're going to do is we're going to inhale and lift the knee. We're going to exhale back, inhale and lift the knee, exhale to the side on the right. Okay? And then we're going to alternate between these movements. So when you're ready, let me get my space nice and ready. Okay? Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. And to the side. Good. All right, we're going to do the same thing on the left. Are you ready? So you inhale, bring that knee up. As you're exhaling, the toes on the left side come behind you. You inhale up again. This time, as you exhale, you'll bring that left foot to the side. So you inhale up and back. Inhale up. Nice lateral move to the side. Inhale up and back and to the side. One more. And back and to the side. Left foot comes back. We'll do it again on the right side. Inhale up and back and to the side and to the side. Side, one more on this side, and back, and good. Right foot comes back. Let's do it again on the left side. Lift that left knee. Toes are on the floor behind you. Lift the left knee. Toes are on the floor to your side. Inhale. One more set. And back and to the side. Good. How's that feel? You may want to move around a little bit. Okay. We're going to do one more set. So right and back and side and side and side and side. Good. Bring that foot right back to the floor. Again, move as fast or as slow as you feel comfortable. Take a break whenever you need to. Left side, knee comes up. Then you bring those toes behind you. Knee comes up and it's to the side. Knee, toes, knee comes up to the side. Knee to the side. One more. And to the side. Foot comes back. Good. Move around a little bit. Shift your weight from side to side. How's that feel? All right, so since you're behind your chairs now, again, feet are about shoulder width apart. Toes are pointed forward. Fingertips are lightly placed on the back of your chair. Inhale up. You're coming up on your toes, lifting those heels. Press back, press back. Feel those hamstrings stretch. Inhale up. And we come back. Inhale up. Once again, your pace. And last one. Up and back. Good. Toes come back to the floor. Wonderful. We're doing well. Hopefully you are feeling that the warm-up was necessary because this is a little bit more intense. And if you're seated, remember you can do these movements in your chair. Just modify them with us. So I'm going to work on our core a little bit more right here. So let's get positioned. Feet are about shoulder width apart. Now when you're standing, you stack your joints. Shoulders are under the ear tips, hips are under the shoulders, knees are under the hips, ankles are under the knees. And once you're in alignment that way, you want to be sure that your chair is close to you in case you need the chair. So you may want to start out holding on to the chair or at least having a finger or two on the chair. We're going to be strengthening the core, but we're working on balance as we do. And as you lift the left knee, your right elbow will come towards the left knee. It's not necessary that you try to touch the elbow to the knee. It's just allowing the elbow to lead so that you're twisting your core, your abdominal muscles are tight, and it will look like this when you're ready. So I'm not holding the chair, but it'll look like this. It's a lift and a twist. A lift, you take your time. Abdominal muscles are tight. Take your time. Really twist. Get those core muscles working. We're working on strengthening our back as well. You take a break when you need to. If I haven't mentioned it, remember you want water before, during, and after. Plenty of water. Stay hydrated. I'm going to do 4 more. Our right and the left is 1 and 2 and 3, and 4. Wonderful. How's it feel in this area? We're getting stronger. We're getting stronger and stronger and stronger. Good. Move your shoulders a bit. Maybe bend the knees a little bit. Come up on the toes, helping with the flow of the synovial fluid. All right. Okay, so we're going to keep on moving standing. If your strap is nearby, would you please get that so that we can continue? We're not going to be doing too much with the strap, just a little bit for the upper body. You're in alignment still. And when you're ready, you see this class, I've doubled my strap this time. But actually, for the movement that we're going to do, I'm going to have my strap at its full length. All right. So the arms come forward. I'm just going to extend. You extend your arms forward. Find your hand position on the strap, whatever's most comfortable for you, because we're going to be lifting up. And then you're going to decide how far back you're bringing your arms. So if you want to stop here, please do. However, if you are inclined to come all the way down, please do that. So you lift up, overhead, and forward, chest. And then you bring the arms up overhead. You bring those arms back behind you, however you feel comfortable. Now, maybe you've had surgery. Maybe you have some challenges. Do what you feel comfortable and safe doing, please. Up and over, and then up, and we bring back, and up, and over, and back, and forward, right here. Good. So you may want to move those shoulders around a little bit. We're going to use the strap a little bit more when we get back into our chairs. So just please still have it nearby. That's all we're going to do with it standing today. And we're just going to do a little bit more in our chairs. So wonderful. We're also going to be using our weights when we get into our chairs as well. So on that note, let's get back into our chairs. Not too much standing today. Back into our chairs. All right. Wonderful, wonderful. All right. So I should have kept my strap out. Let's just get our right foot, get into your chairs comfortably, please, into alignment, safe again. And then once you've done that, I'm going to ask you to just place your right foot into your strap. You're just going to place that right foot into your strap. Okay. And the strap is just going to be used to help you to extend your leg and to stretch it. And you're going to decide on your hand placement. You're also deciding how high you're going to lift that right leg. Okay. Your toes are pointed forward. And you just want to allow the strap to help you. But if you don't have a strap, then please just lift that right leg as high as you feel comfortable. Your toes are pointed forward. You check your alignment, and once again, without the strap, you're still able to lift that right leg and have those toes pointed toward the ceiling. Then you lower that right foot, and then we're going to move to the left side. So the left foot comes inside the strap, and you decide how high you're going to lift that left leg. Your toes are pointed toward the ceiling, and you just hold this stretch. You feel the muscles, I know that you do. And the strap is just helping you. And we hold it here, feel the stretch. And then you release it. And we're just going to move to the right side again, same thing. Lift up, toes pointed forward, pointed toward the ceiling, I should say, is better. Up toward the ceiling, toward the heavens. Feel the leg, feel the muscles. Lower body strength. Let's do the left side again. There we are. Okay. So now when the leg is lifted, the foot that's on the floor is flat. Those toes are pointed forward, and the toes on the lifted leg are pointed toward the ceiling, toward the heavens. And that's the last time on the left side, and we'll do one more on the right side. Bring those straps into a very comfortable position for you. And then you lift up, allow the strap to lift. You notice that I'm allowing the strap to lift to help. So this is considered a prop. So it's helping. Relax and hold. And then you lower gently. You want to lower gently. Good. All right. So that's a nice lower body stretch as well. And then you just place your strap wherever it's comfortable for you. And as you're placing your strap in a very comfortable place, convenient place for you, I'm going to get my weights. You get your weights as well. Please decide what you're going to do. Are you going to use your body as resistance today, or are you going to use either handheld weights, maybe water bottle, maybe two canned goods that fit comfortably in your hands? You decide. Just please get your weights. Now you'll notice that you decide on the weights sides. You decide on that. I noticed that my weights almost match my outfit. How's that? Okay, good. So come into alignment with me. We're just going to do biceps and triceps. That's all we're doing today, just some biceps and some triceps. You ready? All right, so you have your weights or just your hands. All right, you ready? So we're just going to lift, curl toward the shoulders, and then, wonderful. You'll feel the biceps and you feel the triceps. Abdominal muscles are still tight. Maintain your posture. Only do as many as you feel comfortable. And these are controlled movements. So we don't want to move too fast. Nice controlled movements. That's 7, 8, 9, 10, 11, 12, 13, and 14. Wonderful. And again, however many you do, that's good. Move your shoulders a bit, please, before we move to triceps. And I know you know biceps are here, front, and your triceps are underneath. So we're going to work on the triceps in just a moment. Get comfortable in your chair. And once you're comfortable, get your hands positioned on your weights if you're using them. Your elbows are close to the body, and you need enough space to bring those arms behind you. So you notice I'm inching up forward. When you're ready, you just bring those arms back behind you. Now you'll feel the back of the arms, feel those triceps, and then you forward and back. That's 2, 3, 7, so we're halfway there. 10, 11, 12, 13, and 14. Good job. Good job. Good job. However many, good job. We're getting stronger. Good job. You're putting in the work, and that's what's important. So that's all we're going to do with the weights, okay? That's all we're going to do today. We only get an hour, so I try to get in as much as possible in an hour. And it's only, well, it's once a week when we're on site. The good thing about the videos is you can rewatch them, so that's good. But for this session, just the 1 hour, so I'm doing as much as we can get in this 1 hour as possible. All right. So again, always want to have it safe around your area. Okay. So come back into alignment with me, please, if you would. All right. Now we're going to extend both legs forward again. So your heels are on the floor. And you want to have enough room so that you can come back. We're going to be working the abdominal muscles. So now if your heels come up off the floor, you probably want to reposition yourself. So you want to be in a position so that as you cross your arms over your chest and your fingertips are on your shoulders, your toes are pointed toward the floor. Your abdominal muscles are tight. You want to be in a position so that as you lean back, you're using your abdominal muscles, and then those muscles also bring you forward. And you want to keep the heels of the feet on the floor. So you come up forward, you lean back using those abdominal muscles. So these are chair sit-ups. We're strengthening the core, modified chair sit-ups. And do as many as you feel comfortable doing. And since we're moving at a different pace, many of us, you keep account for yourself so that you know how many that you performed, and when it's time to increase, you'll know where you started. So you be sure to keep your own personal count. Important thing is form. Keep those abdominal muscles tight. Try to keep those heels on the floor. Yes, it's challenging, but remember, Pilates is about strengthening the core, and we want a strong core. So let's just do, no matter how you're counting, we're going to do 4 more starting now. So we can do 4 more together. That's 1. Come up forward. 2. 3. And 4. Great, great job. Release those arms, release the fingers from off the shoulders, bring the feet back up. Great, great, great job. Reposition yourselves in your chairs. Do whatever you need to do before we move on. Okay? All right. So now we're going to do some seated twists. Same thing that we were doing standing, but we're going to do these seated, okay? So get comfortable in the chairs. I know the core, I know, just a couple of them for the core. I know. We're taking a little bit of a break. You ready? I think you're ready. If not, jump in when you're ready, okay? So you're lifting the left knee, twist, twist. We're not going to do as many as when we were standing, so I'll start the countdown now. 4, 3, 2, and 1. Good. Back to center. Great, great, great job. Great job. We're going to do a few more, and then we're going to start. We're going to be able to call it a class. And I hope that you are looking forward to the summer session. We are now about halfway through this semester. So from what I understand or what I've heard, we will have the summer semester classes virtually as well, by video as well. So just keep that in the back of your mind, and you'll be getting information from the college, I'm sure, and I'll share with you what I know so that you are prepared. All right, so get back into alignment. Ready? Inhale up. Arm comes behind the chair. That's the right arm. Twist your torso to the right, and left arm comes across the body. Just want to hold that stretch right there. Let's release the arm from across the body. Bring that arm from behind the chair. Your back centered, and then the left arm, as you inhale up, comes behind the back of the chair. The right arm comes across the body. Your torso now is twisted to the left, and you're looking over your left shoulder. You'll feel that abs are tight. So let's release the right arm, and then release the left arm from behind you. Arms come up, inhaling up. Palms are facing the floor, facing the earth, and we're going to rotate back. And we'll stop here and rotate forward. And that's the final one. Arms come to your sides. Shake out the arms and move the shoulders a little bit. Tap the feet. Let's open and close our hands so that we can get those joints in the fingers, some of that good synovial fluid. Wiggle your toes at the same time. Want to make sure every joint's getting its synovial fluid. The elbows, when we're moving, they get their synovial fluid as well. All right, so we're going to work on the lymphatic system a little bit more as well as some other benefits of this particular posture. Now, we don't always do the lower body, and it can be a little challenging. So, again, just do what you can do, really. As long as there's no pain, just please do what you can do. And I try to be as descriptive as possible. And after some time, I'm sure that it'll be easier. So we're going to start with the lower body. So what we're going to do, if possible, if it's possible, and this is just for those of you who maybe want something a little bit more advanced, okay? So those of you who are not looking for anything advanced, you just keep your feet flat on the floor. But if you want something a little bit more advanced, you're going to cross your right leg over your left, and then you're going to wrap your ankles, okay? And then you're going to inhale up. Now, all of us, please, let's inhale up, turn our palms forward, bring those elbows down. When you're about chest level, then you bring the arms together, lift up that right elbow, sit it inside the left, twist your wrist and your fingers. So now the lower body and the upper body are nice and in alignment. And we're going to hold this posture here. As I said, this is also good for your lymphatic system. And the lymphatic system is responsible for helping us to get rid of waste in our bodies, to detoxify. Let's inhale up. Lift up those arms. As you exhale, your elbows come back to heart center. Inhale up. And you exhale. Inhale, lift up, exhale. One more. And exhale. Hold it here. Maybe bring your forehead to your hands. Breathe in and out deeply. Raise your head. Release your fingers, release your wrist, release your arms, shake them a little bit, please. Now you're going to, if your ankles are wrapped, unwrap your ankles, lift that right leg from off of the left, tap on the right side a little bit. Good. And we're going to do the same thing on the left. So your left leg would come over, the right toes are on the floor, and they're pointed forward. Good. All right, and then you inhale up, palms face forward, bring those arms down, bring them together. Now this time the left comes inside the right arm, wrap your wrist, bring those fingertips together, bring those fingers, forgive me, interlace your fingers. Hold it here, inhale up, lifting up those arms, exhale, inhale. Exhale. Inhale. Exhale. One more. Inhale up. And let's exhale. Hold it right here. Bring the forehead forward a little bit toward your hands. Focus on breathing in and out deeply. Okay. Raise your head. Release those fingers. Release your wrist. Release your arms. Move a little bit. So if your ankles are wrapped, unwrap them. Bring that left leg from off the right. Tap a little bit. Move. Remember how important movement is. Good. How are you feeling? You're probably feeling a little warm, but other than that, how are you feeling? I hope you're feeling better. Good. Hope that if there was any stress or tension that you've just let it go. Just let it go. Inhale and let it go.